In the modern world, we are seeing the emergence of many pandemics and epidemics which pose a serious threat to our well being and to our national security. Ebola is a recent case of an epidemic that has had devastating effects around the world. The recent outbreak of Ebola has been the worst on record. It has affected 22,000 and killed 9,000 people so far in West Africa. The state of healthcare in these nations showed that it was in dire need of improvement. When a few Ebola cases showed up in the United States, it demonstrated how even wealthy nations are ill prepared. Proper approved drugs and vaccines were simply not available to fight the disease. But each occurrence of potential epidemic also brings out laudable global efforts to help those suffering. Organizations around the world team up and help with medical support. In such urgent times, it is crucial that communication is efficient so that life-saving decisions can be made easily. So how can technology help us? With modern technology and sophisticated science, we are also more equipped and capable of containing these threats and making sure that vulnerable populations are protected and the ill given effective medical help. Here, our team wants to propose a solution to Ebola management in the case of Qatar. Qatar is a country which has not had any breaking case of Ebola in the most recent outbreak, but it is in a weak position as it is a hub of global activity and not well prepared in dealing with epidemics. We have the following scenario. The Qatar Health Surveillance Center is seeking to use information technology in an innovative way to contain the impact of Ebola to Qatar. But before we get into our solution, we will have a look at how information technology has been used so far in the global health management of the Ebola outbreak.
Based on our research findings, there are two ways that technology and specifically cell phones can help prevent the spread of Ebola. First, with the help of cell phones, people can easily find and access the essential information about this disease. Second, there are mobile data services available that help track and control this disease by mapping out where the infected population is at and the direction of their movement. Since Ebola is transmissible via bodily fluids during an incubation period of between 2 and 21 days, during which victims may not know they are infected, it makes it particularly important to know where people are going and where they've been.
Technology plays a big part in disease management in the scenario that a breakout has already happened. In such a dire situation, the most important area of management is keeping communication efficient. We found that mobile phones serve this purpose well. We focused on mobile applications at this higher end of problem solving as it is more applicable to Qatar. Ebola Guidelines is an Android app by the company Medical eGuides. This app was created by Medical eGuides with content from the World Health Organization and the United States Center for Disease Control and Prevention. Its aim is to provide healthcare personnel with guides on Ebola and how to manage it. Another smartphone application is Ebola Live Map. This is a live map of all Ebola cases around the world. It uses online informal sources for disease outbreak monitoring real-time surveillance of emerging public health threats. The system is automated, staying updated 24 hours a day. It has options in 9 languages, allowing for a wider audience to access the data.
In order to restore the confidence of the previous visitors to visit the country again, the government officials must pass strict
An
policies.
organized response from the government is key. Information hotlines are very useful in spreading crucial public health information and reducing panic. Well-trained health professionals build confidence in the public that the country is prepared for any future outbreaks. An overall good health infrastructure with advanced technology helps boost security against future outbreaks. Having looked at previous Ebola management attempts, we can now get into our team's proposal. Imagine the scenario where Ebola has broken out worldwide and a number of cases have emerged in Qatar. The disease is in its pandemic state where there is widespread human infection. Those infected are being quarantined at Hamad Hospital special wards under the guidance of the Ministry of Health. More and more patients are being admitted at various stages of illness. But Qatar does not have the most cutting-edge access to Ebola information. and the nurses in these wards need special consultants that have worked closely with the disease before. So how can we solve this problem? Our solution is the proposal of an iPad application, which each nurse in the special quarantine wards can use. This application will be used by the nurse to communicate with an expert in Ebola. But who will play the part of this expert? Our proposal is for the hospital in Qatar to form a communication channel with a specialist doctor in a remote location. This doctor should be someone who is an expert in Ebola, has plenty of experience in working within an Ebola epidemic emergency, and is a doctor who will be dedicated to this channel of communication. This communication channel will be made by the hospital in Qatar partnering with the hospital in the US, which will provide the expertise. The hospital in the US will provide 2 to 3 dedicated doctors who will attend to the calls of the nurses working in Qatar. This app will be called Ebola Health Monitor. This will be the main dashboard page. It will have an urgent update section which provides a live feed of urgent developments in the patients under this nurse. Below that, there is a monitored patient section which is a list of all the patients under this nurse and their status. Below, in large blocks, are the 3 main tasks the nurse can perform. They can contact the remote doctor in the US, find more information on Ebola, and the current threat level of the Ebola breakout. Clicking on the record of each patient takes us to the individual patient record page. This page contains basic patient information, the current symptoms they're exhibiting, and the analysis of their vital signs. These vitals are synchronized automatically to the app via the recording devices on the patient. The devices monitor the patient 24 hours a day, and the app provides analytics for this data. Clicking on the Contact Emergency Doctor button takes us to the call page. This page is a simple voice call being made to the remote doctor in the US. Clicking on the Find Information button takes us to the information page. This page is to display important up-to-date information about the disease to the nurse. All this information is up-to-date and automatically synchronized from a variety of government health agencies around the world. Clicking on the Threat Level button takes us to the Threat Level Map page. This page is there to display live information of Ebola breakouts in Qatar and worldwide. This app is a good technological solution to the management of an Ebola outbreak in Qatar. It provides easy-to-read analytics of vital signs of patients. It makes the advanced care of patients possible by allowing access to expert information by someone who has dealt with serious outbreaks before. It provides psychological support for nurses in Qatar by allowing them to consult with someone who knows what to do. It is simple to use in such a stressful condition. It fits with Qatar's aspirations towards high-tech medical facilities, and it breaks down geographical barriers. Now to get a little bit more into the technical implementation details. Each nurse will be given their own iPad device with Wi-Fi and 3G connectivity. The various data on the app syncs via local Wi-Fi connection. The phone calls are made over Wi-Fi or 3G connection. The monitoring devices are the normal bedside monitoring devices that are available in every hospital. The infrastructure is not very complicated to install. The only main part would be Hamad Hospital partnering with the hospital in the US. Other parts of the infrastructure include providing the iPad devices installed with the app, giving the nurses and remote doctors basic training on how to use the app, and making sure that the hospital has the best Wi-Fi connectivity and speeds. The main cost of the infrastructure would be providing the iPads. 10 to 15 iPads will cost between $5,000 to $7,500 US. Otherwise, this solution does not require an infrastructure overhaul, since everything else is in line with the high-tech medical facilities available in Qatar. Ebola Health Monitor provides an easy way for nurses in Qatar to get expert help on providing healthcare to patients with Ebola. Thank you.